It's time to talk about coding for flu shots. And whether you're new to medical coding or you just need a refresher, Victoria, what's new? What's going on? What is the updates this year for flu shots? I am here to walk you through the process of selecting the correct codes for these influenza vaccines. Hey there, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, tutorials to help you excel in your medical coding career. If you haven't already, highly encourage you to subscribe and hit that notification bell so you can get alerts when I post new episodes. Today's video is sponsored by Part B News, but more on them in just a minute. So let's dive in. When it comes to coding for flu shots, there are a few key things to keep in mind. The type of the flu vaccine, the age of the patient, the route of administration, and even the insurance of the patient. For most flu shots, you're going to need two codes. One is for the vaccine itself, and the other is for administration of the vaccine. Think of it kind of like online shopping, where you're paying for the item, but then you also have a fee for shipping and handling to get that item to your door. So we have the code for the vaccine, and then one code for getting that vaccine into the patient. Now, there's a lot of different flu vaccines and a lot of different codes for the different flu vaccines. So thankfully, a lot of organizations such as the AAFP, the AAP, the CDC, or even immunize.org provide grids for the different brands of vaccines and the coordinating codes based off of their dosage, etc. There's often also crosswalks in EMRs and tools that you can use like iCoder that will give you the code based off of the NDC or National Drug Code. You can find out more about NDC codes in the video that I have in regards to NDC codes. I'll link it up in the little thingy here, and then I will link it below as well. But in addition to all of the different codes for the different types of vaccines, there's also different admin codes, and they can change based off of the route of administration, the age of the patient, or if they're a Medicare patient, there's like a G code that gets used. And speaking of Medicare and all their little exceptions with G codes and such, attention practice managers and physicians, are you ready to stay ahead of the curve with the most reliable, actionable, and expert guidance? Introducing Part B News, your go-to source for Medicare Part B. Each week, Part B News delivers the latest Medicare Part B regulatory coverage directly to your inbox. Stay informed with comprehensive fee schedule updates, expert claim filing strategies, and best practices for coding, documentation, compliance, and payment. In addition to weekly news reports, as a subscriber, you will have access to the Part B News online hub. Here you can access previous issues, coding resources, fee schedules, editor's blog, upcoming events, CEU quizzes, and more. Your subscription includes 48 weekly issues filled with the latest Medicare insights, 24/7 access to Part B News online, and exclusive tools to streamline your practice. Plus, experts are just a click away to answer your toughest questions. Be the first to know about big changes impacting your practice and adapt quickly with the Part B News' breaking news alerts, and they are sent directly to your inbox as the news happens. And the best part, your subscription is risk-free with the 100% money-back guarantee. If Part B News doesn't help you boost revenue and control costs, you will get a full refund, no questions asked. Don't wait, invest in your practice's success. Subscribe to Part B News today and get $100 off with code CCPBN100. So Contempo Coding Part B News 100. Subscribe and save today at codingbooks.com/PBN. Now let's talk more about the CPT codes for flu vaccines. There's several different codes depending on the brand of the vaccine that you're administering. So you have to pay close attention to the type of vaccine, the dosage, age of the patient, and the type of administration. So is it like intramuscular? Is it an intranasal, etc.? Always check the product package or vial or consult with your code books or your organizational resources or grids. The flu zone shot, for example, has multiple codes depending on the dosage given, and we'll look a little bit more at flu zone after we talk about administration codes. Now, coding for the administration of the flu shot is just as important as coding for the vaccine itself. Most flu shots will be an intramuscular injection, but there may be some that are intranasal. But there's a lot of confusion surrounding the administration codes, particularly when it comes to the pediatric codes. The ones commonly used for pediatrics that include an age restriction for peds are 90460 and 90461. Those are for vaccine administration codes for peds. If we look at 90460, that's immunization administration through 18 years of age via any route of administration with counseling by physician or other qualified healthcare professional, first or only component of each vaccine or toxoid administered. And then we use 90461 for each additional component. And in these terms, component refers to a distinct part of the vaccine that targets a specific pathogen or disease. When a vaccine has multiple components, it means the vaccine is designed to protect against more than one disease. For example, the MMR disease protects against measles, mumps, and rubella. So there's 3 components. In an influenza vaccine, the only thing it usually is protecting against is influenza. So there's 1 component, but we have some others that are not like that, like MMR. So with MMR, we have our 90460 for that first component, and 90461 times 2 for each additional component. So measles, mumps, rubella. Now, flu shots only have 1 component, so it's just a 90460. But remember, this is not just about them being 18 and under. It also says that counseling has to be performed. And that means there has to be documentation supporting that the counseling was performed. So what if it wasn't, or at least maybe that counseling wasn't documented? Well, in that case, we can still use the 90471. 90471, some people think of this as an adult code, but it's not. There is nothing in the description or indicators saying that this is for adults only. In fact, the description, you can see it right here, says immunization administration includes percutaneous, intradermal, subcutaneous, or intramuscular injections, 1 vaccine, single or combination vaccine/toxoid. The difference here is that there's no requirement for counseling, and that is per the entire vaccine and not per each component of the vaccine. So going back to our MMR example, it would just be a 90471 if we're using this code. We wouldn't bill for each component. So for example, if a patient is 10 years old and they get an intramuscular flu vaccine, but we can't find any documentation of the counseling, we can still use that 90471. That is not a quote-unquote adult code. It's that we have 1 code that's specifically for peds and for if counseling was done and documented, and then 90471 does not have an age restriction. But then we have 1 more wrench thrown in here, Medicare patients. Medicare is special, so it has a G code that they want you to use for Medicare patients. So G0008 is for administration of influenza virus vaccine. Why aren't they all this straightforward? I don't know. However, there is one additional other thing that is fairly straightforward, and that's the diagnosis code. No matter what age or insurance or any other factors, any and all vaccines, we're going to tie to code Z23, which is just encounter for immunization. But just to demonstrate, let's take a look at Fluzone. So even though this is the same brand of vaccine, because there's different recommended dosages for different ages, different insurance factors, the counseling factor, that can all impact our code selection. So if we look here, if we have a toddler, one of the recommended dosages for the toddler would code to a 90647 for our Fluzone vaccine. But if we have that counseling documented, we would use a 90460 for admin. What if we don't have that counseling documented? Then we have to use our 90471 instead for the admin. Now, an adult patient who has a Fluzone shot has a different recommended dosage than a peds patient. So we're going to code that vaccine a little bit differently. But we're going to use the 90471 admin if it's an intramuscular. And then for Medicare patients, oftentimes they have a high dose recommendation. So they might have an even different vaccine code than the non-Medicare patient. And of course, they want to use that G code for Medicare for the flu vaccine. Medicare has a couple of different G codes for vaccine. I believe it's flu, pneumo, and there's a couple others out there. Now, another thing I really want to stress upon in regards to flu shots is the component of the office visit. If a patient's coming in just for a flu shot, we don't add on the 99211 or what we often refer to as the nurse visit, because all of the reimbursement for that service is included in the vaccine and admin. And billing a 99211 in addition to that is probably going to get you a lot of denials, possibly some wonky billing signals sent out to your insurance companies. There's actually claim edits in place. that won't allow for reimbursement of a 99211 with the admin code. And when you think about it, a 99211 is such a low level of complexity, it's hard to warrant saying to add like a modifier 25, which indicates that there would be something significant done in addition to the procedure. So the flu shot and the 99211 really should not be billed together. However, oftentimes patients are in for something like a physical or further follow up of their chronic conditions. And while they're there, they're like, hey, since you're here, you know what time of year it is. How about we give you your flu shot? In that case, what we're going to do is bill the office visit to the appropriate level and add on modifier 25 to that office visit code to indicate that there is a separate procedure, the vaccine administration, and it was done on the same day by the same provider. And we have to make sure that the diagnoses are separated. So Z23 goes on the vaccine and the admin, and the other diagnosis codes, whether it's like the Z00.0 for the physical exam or for whatever the chronic conditions are, that has to get attached to the E&M. Make sure that you're separating the diagnosis codes. So, recapping the key points, make sure that we are selecting the correct CPT code for the specific type of flu vaccine and dosage we're getting. Make sure we're using the appropriate admin code. So, 90471 for the intramuscular for a single vaccine. If we're adding on additionals, we might have to add on a 90472. Maybe they're getting a flu shot and a COVID shot on the same day. If we're doing the PEDS ones, make sure that we are checking if the counseling was performed. And if we are using those counseling codes that we're billing per vaccine components, and make sure you are using the ICD-10-CM code Z23, that's the easy part, and have the documentation to support everything. Make sure that all of the drug information is put into the medical record. Make sure that you have the right documentation of counseling if it was performed. Following those steps will make sure that you are coding your flu shots accurately and efficiently. And there's nothing wrong with making reference sheets for the commonly used types of flu shots for your clinic. And that's a wrap on coding for flu shots. I hope this video has given you the confidence to tackle flu vaccine coding with ease. And if you need more expert advice on coding, my friends at Decision Health have what you need. Definitely check out Part B News for the scoop on all Medicare info for sure. I hope you found this video helpful. Be sure to give it a thumbs up, share with your colleagues, and subscribe for more medical coding tutorials. And until next time, just keep on coding on.